If you're pregnant, around pregnant people, or have had kids already, you've probably heard of hypnobirthing. Now, hypnobirthing is one of my favorite tools for birth, and it's why I became a certified hypnobirthing support practitioner. Saying that, however, I do recognize that it's not for everyone, but when I have seen it being used consistently during a birth, it's amazing the difference in the whole atmosphere of the birth space. In fact, the very first birth I ever attended in my entire life was a hypnobirth. And it was so peaceful, and mom was so in the zone that none of us, not me, her husband, or her two midwives, even realized that her baby was coming and that she was actually pushing. I barely had time to get my camera out to capture the moment that she pulled her daughter up out of the water. And for that matter, the midwives barely had time to put gloves on to help catch this baby. That's why in this video, I'm going to be demonstrating some of the breathing techniques that are specific to hypnobirthing. And I hope that even if you decide to not go full on hypnobirthing, that these techniques will help you through your labor. Hi, I'm Ashley, and I'm a doula, a birth photographer, and a childbirth educator in the Greater Toronto Area. And I'm extremely passionate about informed and empowered birth. Make sure you subscribe to my channel so you don't miss any tips, tricks, and advice to birth and parent like a boss. Before I start with the breathing techniques, I want to reinforce that hypnobirthing is so much more than just breathing. It's actually a full childbirth education program with a focus on gentle and relaxed birth using self-hypnosis, breathing, visualization, and audio for relaxation. But breathing is one very big part of what makes it work so well. And really, breathing in labor to begin with is hands down one of the most important things to learn. So the first breathing technique is called calm breathing. And this is one that you do between surges. So you start by taking a deep breath in to the count of 4, hold for 2 counts or a slight pause, and then breathe out for 8. So I'm going to demonstrate that. You take a breath in for 4, so again, I took a deep breath in for 4 counts, I paused, and then I released my breath for 8 counts. And you would repeat this between your surges. So this is a great way to initiate relaxation, to center yourself, to resume relaxation, and to get ready to go into a deeper state of hypnosis. The second breathing technique is called surge breathing, which is exactly what it sounds like. So in the hypnobirthing world, surges are contractions. It's just a slight change to the language to make it a little less about pain and more about power. So what this breathing does is to help you work with your body during surges to open the cervix and allow your baby to descend into position. Now, this is one technique that does need practice, and I'm going to be honest with you, I won't be able to do it perfectly because I have not been practicing. But ideally, what you want to do is inhale slowly while counting rapidly to 20. When you have inhaled as much breath inward as you can to fill your body, you slowly exhale to a count of 20. So you want to fill your lungs and your whole body with as much breath as possible during that breath in, and take a long, slow breath out. So I'll demonstrate that for you now, and we'll see how high I can count. Okay, so I got up to a count of 12. So, and when I got up to 12, I then released for 12. So you want to focus on keeping the same pace in as you do out. And if it helps, you can imagine an internal balloon slowly filling as you inhale and then letting it gently float away on exhale equally as slowly. Now, if you can't make it all the way to 20 on your first attempt, like me, don't worry. Count up as high as you can and then count down for the same amount of time and keep trying to work your way up to 20 seconds. So I will do that again. I'm going to count, I'm going to breathe in and count as high as I can, hopefully make it up to 20, probably not, but we'll see. And then I'm going to count down as I exhale for the exact same amount of counts that I had on the inhale, okay? Okay, so I got up to 14 that time, so it was a little bit better. It does take practice. It's not something that comes naturally, and it is a little bit awkward to when you first start doing it. So the final method is called birth breathing, and you use this during the second stage of labor or the pushing phase to breathe your baby down. It is intended to help the natural expulsive reflex and to get away from the directed Valsalva pushing that is so common, especially in hospitals. And the Valsalva pushing is when you breathe in, then you hold and you push for as long as you can, and then you breathe out again. So it's literally that pushing that you see a lot on TV and in movies. So Valsalva pushing can actually cause the sphincters of the vaginal outlet to tense up, making the baby's head face more resistance as they're trying to descend, which can then reduce the flow of oxygen to the baby and cause the heart rate to decline, which is obviously something that we want to avoid as much as possible. So with birth breathing, also called J breathing, as the surge begins, you take a short but deep breath through your nose and direct the energy of the breath to the lower back of the throat and then down through your body in the form of a J, down and forward. So I will demonstrate that for you. So you want to take a short but deep inhale through your nose, and then you want to direct that breath down the back of your throat, down your body, and into a J motion, down and forward, so that it looks, I know you can't see my breath, but it'll look something like this. So again, facing this way a little bit, it's going to look like this. You take a short but deep breath through your nose, and then you push the breath down your throat, down your body, and into a J motion. You have to kind of imagine your breath doing this motion. So when I'm doing that, I like to envision my breath forming a J, literally forming a J as it journeys down. So you want to kind of allow the muscles in your vaginal area to open as though you were letting the breath out through them. So you're literally, the breath is coming in, down the back of your throat, all the way down, and then out through the vagina. You want to repeat this breath throughout your surge to help nudge and encourage your baby to gently descend. So again, you take a short, deep breath through your nose, direct the energy down the back of your throat and down your body in the form of a J, and imagine the breath gently nudging your baby down. Breathing is so very important for birth. If there's one thing that I hope everyone learns before the birth, it's how to breathe. So I hope that this video was helpful to you. I'd love to know in the comments whether you're interested in any other hypnobirthing techniques, so pop it down below and let me know. And don't forget to grab your printable birth affirmations from the link in the description. And if you want more doula tips and tricks, make sure you subscribe and hit that like button and share with anyone in your life who is pregnant or a new parent. Thanks for watching, and I'll see you on the flip side.